Hey guys, Jimmy Yen here, the acupuncture guy with Achieve Integrative Health, and we're going to continue the topic of how to get rid of that pain in your butt. Today I'm going to teach you how to stretch it out, okay? So what you're going to do is you're going to get your left leg, you're going to bend your right knee, both knees, you get your left leg, put it on top of your right knee, okay? And then I'm going to go sideways. Then you're going to lean back and you're going to stick your hand in between your legs, and you're gonna pull on your right leg, and this is really gonna stretch that glute, okay? It's called a piriformis stretch. This will really help any of that butt pain that you're having, okay? So again, you can do opposite legs. You're gonna stretch this butt right here, okay? I already taught you the acupressure, the QRA acupressure, and today I taught you how to stretch it out. So both of these together should help you take away the pain.
I had woken up one morning and my left side of my body was completely numb, and went to neurologists and had a lot of tests done, and they weren't able to help me. And I had two choices: one, get a epidural put in my spine so that they could put some meds into me, or to come to an acupuncture place, and chose the acupuncture because you don't want to mess up things that you don't know. If whatever's wrong, you don't want to mess it up. So coming here, I was very, very skeptical, and first 3 sessions I noticed I felt a little bit better, but it wasn't markedly different, so I wasn't sure how it was going to work. By the second week, I felt a little bit better and kept on with the treatments, and my left side of my body, everything works, and I'm almost completely back to, well, better than I was when I started.
Jackie put 500, yes, 500 milligrams, not 5,000. So it ends up to be 1,000 milligrams or 1 gram per day. Again, this is a maintenance dose, right? If you are in severe pain, then you can do the same thing like the fish oil. Do 3,000 milligrams per day, which is 1 capsule 3 times a day, right? That's 3 grams. In Chinese medicine, we actually use even more. We would use up, sometimes we would use up to 15 grams a day. That's 15,000 milligrams per day. But here's the thing about it. This is not what I'm recommending y'all do. Because in Chinese medicine, we never prescribe herbs as a single herb. It's always in combination with at least 30, 40, 50 herbs, okay? But so in a formula of 100 grams of herbs, we would put 15 grams of turmeric, and just to guide the other herbs' functions to the shoulder, okay? Flavonoids. These are found in fruits and vegetables. So your berries. This is why berries are so great. Every single dietary plan, detox plan, always recommends people, weight loss plan, always recommends people do berries, because berries have flavonoids, right? Strawberries, blueberries, even green tea and red wine. So they promote neuronal signaling, aka communication. It increases production of an antioxidant, which antioxidants are there to eat up. They're like Pac-Man. They eat up something called free radicals. Free radicals are basically debris, waste, toxins. When they clump together, does anybody know what happens when free radicals clump together? What does it form? Anybody know? You can type it in the chat if you know. Nobody knows. A tumor. When free radicals clump together over time, it causes a tumor. And some of those tumors are malignant. Exactly, Linda. So these antioxidants are like Pac-Man that eat up these wastes to prevent them from clumping together, right? And these flavonoids are also anti-inflammatory agents, decrease inflammation, right? So So let's talk about curcumin. It's commonly known, Indian cuisine, right? It functions as an antioxidant, anti-inflammatory, antimicrobial agent. So in this specific, this experiment, this research, they found curcumin improves cognitive function in patients with Alzheimer's disease because it improves communication, right? Any type of, even Alzheimer's, it's a lack of communication. They noticed that population of elderly Asians, the assessment of cognitive function with a mental examination test revealed that those who consume curry frequently perform significantly better in comparison with those who almost never ate curry. You see why I said some of y'all are going to be eating curry after this, right? So curry, now the traditional curry, right? Not like curry that has all of the, I don't know if they put MSG, but chemicals and all that stuff. Traditional curry, right? They use curcumin in it. And if it has that, it actually can improve your cognitive function. It improves your brain function, okay? How long does it take? They found supplementation of curcumin for 3 weeks before and after experimental traumatic brain injury. It only took 3 weeks, 3 weeks of eating curry, okay? It was a lessening of the consequences of the injury of the synaptic plasticity markers in cognitive function tasks. Again, what does that mean? It improved the communication within their brain. Just after 3 weeks of eating curry, right? So everybody should be eating curry every single day, right? In the rat model, curcumin has been shown to assist recover from cerebral ischemia, which is lack of oxygen, brain injury, by preventing blood-brain barrier damage. Blood-brain barrier is super important. Not to go too detailed, but the blood-brain barrier is a strong barrier. It does not allow everything to go into your brain. If our brains did not have this strong barrier, we would like instantly die because of all the toxins that the rest of our body accumulates, right? So this blood-brain barrier is super important to prevent unnecessary harmful toxins, bacteria from entering into our brain, right? And so curry or curcumin can help you strengthen that blood-brain barrier. The next thing, dietary polyphenols, green tea. Yeah, we've all heard of green tea. We've all heard that green tea is so good. Green tea actually is good for the brain, okay? Green tea reduced cognitive deterioration in aging, right? A lower prevalence of dementia is found in Japan because green tea is consumed excessively in Japan, right? Long-term exposure to green tea has shown the potential to reverse some of the degenerative effects of aging in the hippocampus of rats. What is the hippocampus? The hippocampus in our brain controls learning and memory. So if any of y'all are saying are having the situation where man, my memory is just not as good as it was before, right? How many of y'all have had that, right? I think all of us. So green tea can actually help restore. It can reverse some of the degenerative effects of aging on the hippocampus. So it's learning and memory. Your ability to learn new things is controlled by your hippocampus. Now, before you go out and just start chugging gallons of green tea, let me tell you the side effect of that. There's a book called The Enzyme Factor. It was written by a gastroenterologist surgeon. He was Japanese, Dr. Shinya. And he researched green tea, and he found it was true. Japanese people drink a ton of green tea. So yes, they have a low prevalence of dementia, but they also have a higher incidence of gastritis compared to Americans. Because here in the US, we don't drink as much green tea as much as in Japan. Okay, why is that? Because green tea has something called tannic acid, and tannic acid causes inflammation in the stomach, which causes gastritis. So a lot of Japanese people there's a higher prevalence of stomach cancer, just not a lot of dementia. So the point of me telling you that is, even though I'm sharing you all the good things that you can eat, you still have to do it in moderation. Okay, it's not like you just, oh, this is so good, so I'm just going to buy a whole bottle of green tea capsules and I'm just going to chug it every day. No, don't do that. Okay, and resveratrol, we've all heard of this, right? So these are found in berries, grapes, and red wine, right? So these protect your cells in the heart, brain, and kidney. Key thing is berries. Berries are going to be your superfood. Again, this is why every dietary program encourages berries. They're lowest in fructose. Your brain does need fructose, okay? I mean glucose, not fructose. It needs glucose, but you don't need, don't go out and just like chug a gallon full of berries, right? They still have fructose. It's still sugar. It still turns into sugar, right? Sugar will mess up your blood sugar metabolism. Is 1 or 2 cups of green tea a significant amount? Oh, great question, Jackie. Yes, limit yourself to 2 cups of green tea per day. And if you're going to drink green tea, do not drink ice green tea. It has to be hot or warm, steeped, okay? On a side note, the reason why I tell my patients, warmth invigorates. Cold stagnates. So the question will be, do you want your blood circulation to be invigorated or stagnated? No. Yes, and Chris said organic green tea. Yes, you should get organic green tea because yes, there's a lot of pesticides on it, right? All right, let's move through this. This was an interesting one. This is not necessarily what to eat, but it's more about not to eat. Caloric intake. I don't think caloric intake was the right term. They should have used intermittent fasting. They found that intermittent fasting